We're live? Yeah. Thank you. Good afternoon, everyone. This is the February meeting for the Jefferson County Health Department Board of Trustees. I want to call it to order at this point. Could we have the roll call, please?
Mr. Pigg, Dr. Henry, Ms. Stidham.
Here.
Mr. Deal,
Here.
Ms. Taylor.
Here.
Okay, so we have two folks missing, but three people here, so we do have a quorum. And we normally read the mission, vision, and purpose. Ms. Stidham, would you do that, please?
The mission is to promote positive health outcomes through delivery of foundational public health services. Vision, a healthy Jefferson County. Purpose of the Health Department, RSMO 205.050. The Jefferson County Health Department is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Okay, thank you. And we've been reciting the Pledge of Allegiance. Why don't we do that at this point? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. So the next order of business is approval of our agenda as written and sent out to everyone. Can I have a motion to approve it as written or change it?
I'll make a motion to approve as written.
Second?
I second it.
Okay, so the agenda is written, is approved. We would welcome any guests, but we only have the representative of our leader here. You're welcome. Thanks for coming. Next item is approval of the January 22nd, 2026 meeting minutes. One of the board members who is here today was not at that meeting, so we don't have a quorum to do that approval, so we'll table that till next meeting. Next item is approval of the January 2026 expenditures. And the amount that I have is $888,552.72.
I make a motion that we approve.
I'll
Okay.
second.
Got a motion and second to approve those. All in favor, please say aye.
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 All right. Approval of the January 2026 electronic payments. The actual amount for those, I believe, is $620,947.00.
No, that's for March. January should be, or February should be all right.
Oh, okay. I put the wrong number in the wrong column. Okay, so the January electronic payments are actually $445,020.27.
I make a motion that we accept those numbers for
Okay.
electronic payments.
Motion to approve that amount in a
Enclosed.
second?
Second.
Okay, all in favor, you say aye.
Aye.
All right, and our next item is pre-approval of the March 2026 electronic payments. And again, hopefully I have the right amount, $614,513.00.
No, I think it's 620.
The revised one.
Oh, okay. Sorry again, folks. we had a change to that. So that, the correct number is $620,947.00.
I'll make a motion to approve the March electronic expenditures.
And I second that.
Okay, so we have a motion and second to approve that amount. All in favor, please say aye.
Aye.
Moving on, we have next item as the director's report. Mr. Sykes?
Okay, I think last month I talked about Capital Day advocacy that's going to happen in Jefferson City on March the 10th. We are going to travel up and be participating with that on the 10th. There'll be other local health departments and MoSIFI that will help us meet with our legislators. I've already spoken with a couple of our legislators and set up appointments to meet with them and just show them what we do here in Jefferson County and, advocate for our health department. I've been trying to give you updates on the Rural Health Transformation Program. I kept it in my report. I don't have any updates to give at this time, but, when you can, please visit the website on that. Again, I don't know how it's going to affect our county at this point, if it will at all. It's more for the rural areas, but we're still keeping our eye on that program. Update, I talked about this at last board meeting, an update on our 2026 food and beverage permits. Seems like this is getting to be a smoother and easier process each year, although I'm not the one that's doing it, Dan's here. But 92% of the facilities renewed on time this year compared to 85% last year, which both those numbers are way up from what it used to be. 98% renewed by the end of January this year compared to 92% last year. We did not have to close any facilities due to failure to pay. We did have some that were late, and staff, as usual, they go out and visit these facilities. We only had 11 of those that they had to visit, and they were able to pay on time. So again, no facility had to be closed for lack of payment. So I like to tell Dan and all the environmental group they did a very good job on that.
Steve, what's the total number of food establishments?
We sent out we sent out 944 renewal notices. I believe 908 renewed. So we did have some closures, and then there's also some changes of ownership, which we don't make them go through the renewal process when there's a change of ownership. Is that on?
No.
Check, check. Oh, there it is.
Should I repeat myself? Or?
No,
No.
we're good, thank you.
You'll be up in a little bit.
Thanks, Dan. Thanks, Steve.
Little update, this has been something that I know the board has asked about, and it's finally starting to we're starting to have progress on this. We are beginning the process of removing Windstream's involvement in our IT infrastructure. It's a coordinated move to do this between us, Windstream, and other parties to make sure we have a smooth transition with our Arnold location. The big thing is our cameras, making sure that we don't have a lot of downtime when this transition happens. Our goal is hopefully by May of this year that this will be completely switched over and we will no longer have Windstream. With that, we should see a significant reduction in our cost. So keep your fingers crossed. You would think that this would just be a simple flip that switch on and that switch off, but it's more complicated. And Steve, Mr. Ferry is working really hard with these companies, and they're not the easiest to work with, but I'm confident we'll get this done. Another thing that I received an email from Christy regarding a notice of legal fee increases. And I went back and looked at our original engagement letter with them. It does allow for a 7 to 10% increase annually. And so our current fee with her firm is $300 per hour, and the increase would go to $325 effective of May 1st of 2026. That does not necessarily need to be approved by the board because it's in our agreement written in. It's more of a information that's going to happen. I don't believe it needs approval, right? Because it's in. Tim signed it, so it's already in there. But so those, and I've been very happy with the service. I can tell you, it's Christy responds very quickly, and I think she's given us some good information. And we've had a lot of things going on that we've had to talk with her about, and so I've been very happy with the services so far with Christy. I got a call from our county executive the other day that he was going to place a resolution on the agenda for the county council to vote on February 23rd, which was that Monday night, I think, which would designate me as the county health officer as required by state statute. And I believe that would have to have 2 readings because this is the consideration of the resolution that you helped provide, right? I wrote it. Yeah. So it did get put on their agenda. I don't know the outcome of the vote, but he did call me and tell me but that's required in February of each year. So they're following up on that. And then I wanted to do this. I talked about our blood drive. So to follow up with that, we had a blood drive on January 29th, and it felt like I think our goal was to collect 20 units of blood, and we collected 31 units. That was not just our staff, but community members also came in. We did it in this room, and it worked out really well. And so I wanted to give a thank you to the staff members that worked on putting that together. I think it was a huge success. And we will be doing 2 more blood drives, June 4th, September 29th is what I have down. Are those going to be in this building as well? Yeah. Be in this office again. So June 4th and September 29th, we will have another blood drive. And that is my report.
Very good. Who do those blood units go to?
It was through Impact Life, were the ones doing the collections with this department.
Okay, thank you, Steve.
Yep.
Our next item is whether or not any of our board members have questions on any of the program reports that they got in our board packet. Any questions? Nope. Okay, hearing none. Again, we have a public comments item. No member of the public is here. Old business is next, and the action item is to act on the recommendation to amend the JFCAC, which is the Jefferson County Community Action Corporation, approve their WIC lease. And a copy of that lease is in your packet. So, do you want to talk about that, Steve, or?
Well, do you want to go ahead and make a motion? Don't you make a motion, and I can?
Okay.
I'll make a motion to approve the WIC lease.
Okay.
Second? We have a second?
Oh, I second that, I'm sorry.
Okay, sorry. Okay, so we've had a chance to read that. It looks like the monthly amount's staying the same, is that right?
So, yeah. This is, I think, round 3 of this that we have voted. So I thought we had this figured out. They asked that we do a month-to-month or 6-month because they're looking to move out. I said we could give you the whole year and just let you terminate early, but then they're their attorney reviewed it, didn't like the terms, the wording. So I just asked Christie and their attorney to work it out, and they came up with something that they both could agree on, that I'm good with it. It does allow them to terminate early, which doesn't really affect us at all. They do have to give us notice, but it will allow them to move out if they do find another location. I didn't want to do a month-to-month or 6-month, because in the back of my mind, I felt like if they don't find a place and we don't renew, that's really going to reflect on us that, hey, did we kick Wick out of our building? I didn't, you know, it's not, I think it's better to allow them to continue until they find a place with this year's, a full year term. So I think the wording was put in to allow that. And so hopefully this will be the final version of this lease.
This has gone through their council, and they have said they will sign this one.
Okay.
What was it again, why they were wanting to leave or move? Or,
Why are they wanting to?
I can't remember.
They're looking for another spot, and if they find a spot that they can get for cheaper, they want the ability to get out of the lease with.
Oh, so they're looking for a less, okay.
Yeah, I think there's some other reasons, but I'm not
Okay.
sure.
I couldn't remember the initial reason why they were
And
leaving.
it's not that it's not going to break us if they
Right.
need to terminate early.
Yeah.
Okay, so any other questions? So we have a motion and a second to approve that lease as written. Hearing no more discussion, everyone in favor, please say aye.
Hi.
Aye.
Aye.
Okay, so that lease is adopted.
And then they just need to sign it, and then it's all good.
Next item of new business is a presentation of the Health Department 2025 Annual Report.
We're gonna have Breanne come up and give this, she put this together for us.
That was-
It's probably underneath, yeah. That little light's not on. Huh. Can it,
You want one of ours?
that won't reach.
Well, I tell you what, I'll just talk really, really loud, and it'll be fine. Okay, so you all have a copy of the 2025 annual report in front of you. It's also on our website. I did put together a quick little slideshow, video slide, just to kind of show the highlights of what we've done, our impact this year. So I just have some of our photos too. This was from our very first drive-through flu vaccination clinic. So that was the first time we were able to do one of those because of our new building with the setup. And it went really well. We had some really good feedback. And we partnered with Washington University, which was really great. Just some general stats about our maternal, child, and family health programs. Number of patients, different types of contraceptions that we've provided, the number of youth blood-led screenings that we've done here, that's just within our building. And then this year, within our maternal child health grant, we also created a summer virtual wellness program for families. And so this was the first year that we've done that. It was our pilot year, and we actually had 136 families show up. And they registered, they gathered the supplies, they sent in their submissions. We got a lot of really cool photos of families doing some activities together throughout the summer. So it was awesome. Apparently they can't hear me. So, am I unmuted? Okay, does that work? Maybe it's just me. I think it's just me.
Oh, I'm live now. Okay, so I'll just keep going here. I threw in some of our reviews and stuff. This video is also going to play in our lobby displays, so I won't have those up there. But this was a photo from one of our community events that we did with our smoothie bike. The smoothie bike is a huge hit. I don't know if you guys have seen that yet, but it's legitimately a bike with a blender on it. And the kiddos get to put their ingredients in there. That's Megan, our dietitian. They work with her. She talks to them about like healthy eating and the power of produce. And then they legitimately get to blend a smoothie while riding the bike. It's a pretty big hit during the spring and summer. There's our dental team. And then some of our chronic disease prevention highlights. We did a little over 1,400 wellness labs. And then we kind of broke that down by the number of cholesterol screenings, diabetes screenings, blood pressure, etc. Speaking of Megan, our nutritionist, she had 80 nutrition consultations last year. And then she also provided 11 education classes. And there's some of our lovely board members and our admin team. And on the far left is the DHSS director, Sarah Wilson. That was at our open house. There's Drake driving the new wellness van. Also, I didn't tell anybody I put their pictures in here, so they're going to be really happy with me. These are some of our communicable disease prevention highlights. We provided a little over 3,800 total vaccines last year, our highest one being flu. We also provided over 5,000 STD tests. We did over 300 animal bite investigations, and we also did 432 TB tuberculosis screenings. And then I kind of just put in the little circles there, or highlights of our case numbers. Those are all the cases that our communicable disease team investigates throughout the year. And I just really liked this one. Somebody sent us a really good message, so I just thought that was fun to put in there. That is our environmental team, the wonderful folks that Sykes was talking about before with permits and all of that jazz. That is them. That is another view from our flu clinic, our drive-through flu clinic that we had. Here's some of our environmental health stats. Again, we did over 2,000 food establishment inspections, so that include like initial and then re-inspections and follow-ups and stuff, which Dan can talk to you more about that part. And then in addition, the lodging inspections, childcare, the number of emergency responses and food product recalls that they responded to. And then as well on the other side is kind of our vector. So the number of mosquitoes that were tested for West Nile, the number of trap sites, and then we did over 300 spray treatments. Just another fun little message. That is Mandy and Dr. Kate. That is here, Kate for our family nurse practitioner, for our family planning clinic. This is all of us on the day that we got our new van last year, which was very exciting. And then some of our injury prevention highlights, looking at the different programs that we have. The SHARPS program, so we have 2 kiosks, one in each office. We collected over 544 pounds of SHARPS that were properly disposed of. We handed out 416 doses of Narcan, and then in addition, we have our bike helmet program, car seats, and Project Lifesaver. We had 123 appointments last year, which was really cool. And I leave that up there for a second. And then I think the last one, this is Julie and Rachel, some of our folks that work on our lead. They're environmentalists, and they also work in our lead prevention program. And then the last one here is our linkage to care. So our clerical, our OSA staff processed over 23,000 vital records, which is higher than last year or the year before, so they upped it. We saw 638 mobile health patients. We did 16 homebound vaccination visits. And our resource guide, which is on our website, it's a compilation of all of the different resources in Jefferson County. We update it quarterly. It's had 2,300 views. We get a lot of feedback from the community just about like how helpful that one is. So I always like to point that out. And then just the fact that we like what we do and we're proud to be your public health. There's some more in-depth information in your annual report printout as well as on the website. But does anyone have any questions?
Just a comment on my part, I think the numbers are pretty impressive, especially considering the fact that we moved our building during the year, which I think was, people probably don't really know what a major undertaking that was. And I think how smoothly it went. I don't want to speak for you guys. I know you had to work really hard on that, but boy, I would really encourage anyone who's interested in knowing what we do to take a look at that report online.
Brian put a lot of hard work putting this together, and she's more creative than I am, if you can believe that. She does a really good job at these reports.
Appreciate that. All right, thank you.
Thank you.
Thanks,
you.
Brian. Okay. So the next new business item is to act on recommendation to approve revised open and closed pod MOUs. And those recommendations, again, are in your packets. Do you want to talk about those, Steve, or someone?
Go ahead and get a first and second, and then we can just.
Okay. Can I have a motion to approve that?
I'll motion to approve.
Yeah, I second motion.
Second, okay, first and second, so.
So, yeah, these are points of dispensing agreements, memorandum of understanding, and Christie has looked at these as well. I'm gonna have Gina talk about these. This falls under her programs as the community services manager.
Can I do that from here?
Yeah.
Okay, perfect. Yeah, so appointed dispensing, this is one of the things that really falls to just public health to do. So in a natural disaster, we plan for the worst-case scenario, which is anthrax. If there was an anthrax dissemination, we have less than 48 hours to get antibiotics to anybody who has been affected by that. In order to do that, we will open a pod, so a point of dispensing, to get those antibiotics out. We have two different types of pods, so that's why there's two MOUs. One is an open pod, so anybody in the public that has been affected in some way that's been addressed as, you need to get your antibiotics. Let's say it was at a basketball game, you were in the audience, here's where you need to go. We open an open pod to anybody in the area that needs to come. It could be in this building, it could be, we've used the Civic Center before, we need large buildings with a lot of space to move people through very, very quickly. We have about a 2-minute throughput from start to finish, so we're pushing people fast. And then we have a closed pod, and so that would be for our first responder groups and our long-term care facilities. Because they have medical directors, so fire and EMS have medical directors. Police don't always, but they will report to one of their others. We can actually hand off that medication to one of those partner agencies so that they can take care of their people and their people's families themselves without our first responders having to come through a public event. They're going to be very busy with everything else. So that's why we have the two different ones. And we've had this program for at least since 2012, Dennis, maybe even longer than that, where we've always partnered. We try to keep a list on our first responders, how many employees they have, and then we've kind of done this rule of 1 employee plus 3. So a typical family of 4, some people have less, some people have more, it kind of averages out. But we work with them, we do just-in-time training. They know how to do the paperwork so that we can hand that off, they can take care of their own, and then we can take care of the rest of the general public. Part of our plans is we're supposed to be able to get the entire county through in 48 hours, so our 250,000 folks. It's not going to happen in just one place. So we will work with 5 or 6 different places to try to have open pods, and then all those first responders and long-term care facilities for closed pods. And we have MOUs with them already, but it's been since 2019 since we've kind of revamped it. So we just wanted to make sure that we had the best MOU, that Christie had seen that, and then we'll start that training process over again this year.
Do we keep that much antibiotics on hand all the time?
So we don't, but there are caches all over the state. A last I heard, 6 to 8 hours, they can have it to us. So it's gonna take a couple hours to realize what's going on.
Sure.
Within 6 to 8 hours, we'll have it, and within 6 to 8 hours, we'll be able to spin up our staff, address where we need to go. We have trailers stocked, so we have about 2 hours we can set one up start to finish. And then we'll be ready to go, and we'll open our doors as soon as we can.
And these are kind of open-ended, in other words, it would depend on whatever agencies we're working with for them to sign this
Mhm.
along with us, right?
Yep.
Okay.
Yep.
Okay, any other questions or discussion? All right, hearing none, I have a motion and second to approve the pod memorandums, the open and closed. All in favor, please say aye.
Aye.
Aye,
Hi.
okay, none opposed? All right, so those are approved. Next item is act on a recommendation to approve purchase of a sole source XRF machine, which is a lead testing machine, for anyone who may not know that, with grant funds. And again, I'm not sure if I saw that. Is it in the packet?
What's that?
Is that in the packet?
No. We're gonna have Dan talk on it.
Okay.
You gotta put the,
Right, okay. So can I have a motion to approve that?
I'll motion to approve the lead machine.
Second?
I second the motion, purchase grant funds.
Okay, so we're gonna have Dan, our environmental supervisor.
and this, I believe, and correct me if I'm wrong, this was in is in the current budget that was approved. This is just that we have finally come to the point where we can purchase the machine, found the machine that we can purchase. So this has been approved in the budget. Go ahead. How many hands you need over there?
There we go. All right, so thank you for letting me come before you and speak about how this purchase of the XRF would benefit our agency and the community. Like you said before, an XRF is an X-ray fluorescence analyzer. It's used to detect lead-based paint. The unit that we currently have on loan from the state is the same model that we're looking to purchase, although the current model that we have can only test lead-based paint. The SciAps X550 with lead in soil package would significantly expand our capabilities. In addition to painted surfaces, it can test lead in plastics, polymers, metals, and soil. And soil's the most important one. This would allow us to identify a wider range of lead hazards during risk assessments in the home, so such as cups, dishes, toys, jewelry, spices, which is one that we've identified recently, and then any other item that the children may place in their mouth or ingest. We could also screen bare soil in gardens or play areas. While we would still send soil samples to the state lab for official results, this tool would let us provide immediate guidance to the families, so they wouldn't have to wait to see if the soil was testing high for lead. We could give them direction on what the lead hazards in the home are, whether it's a toy or whatever. This expanded capability would also allow us to host community events where residents could bring soil or household items to be screened. This would help increase lead awareness and help families understand potential risks in their homes. Our licensed lead assessors could also screen soil for property owners, and if the levels are elevated, they could refer them to the EPA for testing and then possible remediation. So we would be kind of a first step to getting them to have their lawn remediated. We were also recently contacted by a company that was seeking, it's a company that does a lot of digging projects in Jefferson County. And they were looking for this exact service from us, seeing if we could screen soil from them. they've come across a few projects where they are digging up soil that's already been remediated by the EPA, and they're looking for direction on how they could keep from recontaminating areas that were already remediated. So this would help us screen that soil for them so that they could keep from recontaminating. This purchase is a sole source purchase because SciAps is currently the only company that offers a HUD-approved XRF for lead-based paint analysis, and it's also approved by the EPA for soil analysis. It uses a vacuum tube rather than a radioactive source. Older models use a radioactive source, and it would have to, you'd have to do a leak test every 6 months on that. So it's much safer than the older models that use a radioactive source. The maintenance on the older models are very costly also. And there's no new radioactive source XRFs being manufactured. So the only ones that can be purchased now that would have this soil testing and lead-based paint testing, they would just be refurbished models. So our assessors have found lead in soil in about half of our risk assessments over the past year. So I think soil is going to continue to be one of the main hazards that we see. Lead-based paint, I think it's still a hazard, about half and half is what we're seeing, soil versus lead-based paint. So this would give us, like I said before, it would give us the opportunity to give direction to the parents quickly instead of having to have the EPA come out and do the soil testing for us. They would still do the soil testing if they wanted to have their lawn remediated because they have to go through that process to make sure that it's above the action level. Let's see. I think that's all I have. So do you have any questions for me?
Would there be any cost to taxpayers if they did find a lead during a remediation? You have to pay for any of that themselves?
Yeah, so it's free through the EPA. There's a company called Tetra Tech that'll come out and test the soil, and they do it in a grid pattern throughout the yard. If they find lead contamination over 400 parts per, I can't remember the exact.
I think it's parts per million,
Parts
I
per
think.
million.
I don't know if it's parts per million or not, but I'd have to look it up. If they find that it's above the action level, then they would bring the contractor out to remediate that portion of the yard. If there's any landscaping or grass, then they'll replace it with equal or better than what was there before. So
Now-
it's free to the resident.
Now, that's the soil part of it, though. If they find lead-based paint in the home, there could be a cost to someone who has to, either the landlord or the homeowner.
Right.
We don't enforce remediation of a homeowner if it's their home, but if it's a landowner property, they would have to remediate. I believe that's the way the law is. So there would be some cost on that part of it, because the EPA is only looking at the lead in the soil.
Right. Gotcha.
Okay.
Okay.
I think it's going to really be beneficial if people take advantage of it. So I don't think folks really understand how many different items can contain lead.
All right.
So, okay, great. Thanks, Dan.
And what was
Oh,
the-
I'm
what was the
sorry.
cost? What was the cost of it?
Oh.
Yeah, I noticed we didn't put that on there, did we?
Sorry, it was right under 30,000.
And we already counted for it, so.
Mm-hmm.
29,675.
And we actually have a grant fund that's gonna pay for it.
Great.
We've had an older model on loan from the state for a while, haven't we?
We've gone through 2 or 3 models probably with them.
Yeah, we used to have the model that used a radioactive source, and we'd have to have it sent off to be resourced every 2 years. The model that we have now is the exact model that we're looking to purchase. It just doesn't have the soil package that can test plastics, polymers, metal, and soil.
Mm.
So, and as far as what we would do with the model that we have now, I think we would have to see like how busy we get with screening soil for residents. But if we don't end up needing it, I think we could give it back to the state and they could possibly have another county that's looking for one, loan that out.
Right.
Yeah.
Okay.
Thank you.
Do we need a vote on this, Christie?
Yes.
Okay.
Motion.
So we've had a motion and a second and discussion. Any other questions? Hearing none. All those in favor of approving their recommendation, please say aye.
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 Okay, it's approved. And we have CDC and FDA updates.
I don't have any updates from our last meeting. I think Melissa handed out the changes and how that affects us, and I gave Tammy a copy of that prior to the meeting. So there have been no changes since last meeting.
Okay, thanks, Steve. All right, do we have closed session today?
The only thing, I don't have anything, I think we probably should wait till next month when we have everybody here.
Oh, yeah, that'd be fine.
So I would suggest we table the closed session minutes and do those next month when we have everybody, and we'll have a discussion about real estate too.
Okay. So no closed session today. Okay,
Topics for next agenda?
sorry.
Do we do topics for next agenda?
Oh, yes. Does anyone have a topic for next time? No, not right now. We'll see. Okay, that takes us to adjournment. Can I have a motion to adjourn?
I'll motion to adjourn.
And
I'll second that.
Second? Okay. Any discussion? Hearing none. All in favor, please say aye.
Aye.
Aye. All right, we're adjourned for the month. Thanks, everyone. See you next month.
Good job, Peter.
Yay.